the last drop. Are you gonna blow your head off? Take good aim and don't forget to duck. Life sucks every Monday and all the way to Sunday, but I wouldn't have it any other way. I don't care how you're doing, what's up or how's it hanging. I'd like to buy this world one last drink. Life sucks all of the time, stick it up your sunshine, and then you'll see the clouds every day. And then you'll see the clouds every day. And then you'll see the clouds every day.
Welcome to the Crazy Life, everybody. My name is Jen. I am your hostess. To those of you returning, welcome back. Those that are new, welcome to you. I'm glad you guys found us. And, so today is the eve of Christmas Eve and trying to get everything ready, which is completely not ready. Trying to make sure everything's packaged and wrapped and stuff needs to be cleaned and beds need to be made and all that good jazz. And all sorts of fun pressures and dramas and whatnot is going to erupt probably in the next few days. So, on the eve of so much fun, how are you doing, Bryan?
I've seen better days. I woke up feeling kind of like I have like a sinus cold, kind of a thing that I don't know. It's the right time of year. I'm actually overdue for it. Usually, as the weather first changes, I get a really bad sinus headache, and for about a week or so. But the weather hasn't really changed so far this year, so. It stayed pretty warm for winter, or fall, I should say. It just became winter. So,
and it could be allergies, because they were saying since it has not gotten cold enough to kill off all spores and allergies and stuff, that people with allergies or sinus issues are having even more trouble this year.
Yeah.
Because of that reason. And it makes a lot of sense. I'm like, yeah, I can see that.
Yeah.
But shall we say Bryan got ran over by a reindeer?
Yeah. Kind of feels like it today. I've pretty much been in bed all day today, so I got up a little while ago so I could do this and just, kind of generally just get out of bed, basically. But honestly, when we're done, I'm probably going right back in.
I actually saw a pretty good joke about that, about Santa is walking back to his sleigh, and all of the reindeer don't have legs anymore. And Santa's like, well, that's the last time I'm going to stop in Detroit before we go on to the next places. And I started laughing. I'm like, yeah, that's kind of cute.
Yeah.
But not to make light of all the pain I'm sure you're probably in.
Yeah.
Because that's no fun.
Yeah, I mean, you've known me long enough to know, and the people who don't will find out. I deal with this so much that it really kind of is almost like a second nature. It's...
Mm-hmm.
It's, I know what usually works for me, so I just go into that mode, and usually I'm, I'm okay after a few days or something, so it's... But usually kind of kicks my butt for, 2 to 3 days, and then I usually start feeling better. So it's got great timing, right before...
All right before the holidays, and you'll feel better after the holidays. That's nice.
Mm-hmm. Be perfect. Nice. Yeah.
Well, that was Max trying to make you feel better with his dulcet purrs. So I don't know if you heard that or not.
No, I didn't, no.
Yes, he was purring into the microphone.
Oh, yeah, well, I'll do that.
Under the disguise of sniffing the microphone.
Right. Yeah, it's and then on top of that, we've got, family gatherings at our house this year, so it's, and even though I can, go off into my room or whatever, it's just not the same as knowing that, okay, we've been here for an hour, so, okay, we can make our our leave
Mm-hmm.
at this point. There really is no leave for me, which never helps when you have anxiety. You always want to feel like you have an out. And, these type of things make me feel like there's no out. Even though there is, it's just, it feels like there isn't,
On the upside, this year, because it's not so bitter cold, you can go outside.
Yeah.
Because I know you guys have a decent porch with a couple chairs on it.
Yeah.
So as long as it's not raining, you'll have that opportunity that, you can still get outside and just kind of get away from things a little bit.
Yeah.
Because you and your nephew, I know, talk a lot, and you and your sister's boyfriend and stuff can just kind of chill out there for a little bit.
Right.
So at least that you've got some options, which is a good thing.
Mm-hmm.
And that's going to help.
It's still not anywhere near the same, but
no.
Yeah, it's better than nothing, but it's not. It's really not that much. Yeah. Well, the idea of going to your safe spot or going to your, safe zone is a whole lot different than basically just stepping outside, where if people realize you've stepped outside, sometimes they will also do it.
Yeah.
And it's like I want to be alone, and
Well, that's why I've already, for the wedding and stuff like that, I've already kind of prepped my team. So that they know that if I need 5 minutes to kind of be quiet and just kind of collect my thoughts, that they'll play defense for me.
Right.
So, and all that good jazz. So, well, speaking of all this wonderful holiday stuff, and I will say it is wonderful. I mean, there is a lot of rough stuff going on, like emotions and depression and anxieties and shoot, my dad called me today at work to vent for half an hour because he had so much anxiety going on in his head. He had to get it out because it was driving him nuts.
Right.
So, we all understand. Everybody has a version of it. Some are worse than others. Some are actual mental disorders, and some are just holiday stresses.
Yeah.
But they do exist.
Well, some people turn their anxiety this time of year into baking and stuff, so
exactly.
It turns out good for everybody else.
Right. Except for those on a diet. That can lead to a whole nother set of anxieties. But
listen, if you're trying to diet through holidays and stuff, you're just putting unnecessary burdens on yourself. You really are.
Yeah. Don't stress yourself out like that.
It's just not worth it. If you want a cookie, have a cookie. Just don't want to have all the cookies.
Yeah, it's 2 weeks. 2 weeks is not going to kill your diet completely.
Probably, yeah.
Probably not. Unless you're a diabetic, and then 2 weeks of eating sugar constantly.
Right, yeah.
That may hurt you.
Yeah.
Don't do that.
Right.
But I will say a positive story. One of my coworkers, his daughter had a fire at her trailer home, which not the positive part yet, people. So she had a fire, and thankfully her and her kids and her husband are okay. But they lost almost everything. Well, in the course of less than a week and a half that they've been out of the house, the guy I worked with, his house where they were staying is now completely filled with presents and clothes and a new TV, oven. He got 3 oven donations.
Jeez.
Yeah, and all this stuff that people are just donating, gift cards, all these brand new things, and people even took the time to call and ask the ages, the sizes, what the kids are interested in,
right?
So they could get appropriate Christmas gifts and stuff for them,
sure,
that they're going to enjoy. And he was saying and what his daughter is planning on doing is anything left over that they can't use, whether it doesn't fit or it's just, whatever, they're going to pass it forward. So they're going to contact the people who donated it, because there's 4 main groups that donated, and contact them and find out how they would like it paid forward.
Yeah.
So do you want this to sell it and then take the money and make a donation in your behalf, or do you want us to give it to the Red Cross or whatever? But they were saying that it was just absolutely amazed them, not just people's generosity, but their thoughtfulness in their generosity.
Yeah.
They're not just giving, canned tuna
Yeah.
or, a bunch of, spam.
Right.
But they're actually giving of themselves stuff that is valuable to them and to a lot of people.
Right.
And they're just giving freely because they feel it's the right thing to do.
Mm-hmm.
So that really kind of underlined to me things that I need to keep in mind through all of the stresses and all the craziness and all the striving for not perfection, but my version of perfection.
Yeah.
Striving for these goals that I place for myself this time of year that may not be the most realistic
mm-hmm.
and definitely are not in necessarily keeping with the season.
Right.
Having my garland just so around my doorway does not affect anyone's life.
No.
So I just need to kind of keep that in mind. And I ask everybody to kind of keep that in mind. And also, giving of yourself is a great way to combat a lot of mental disorders.
Right.
Because giving of yourself, not only will it increase endorphins in your system, increase positivity in your mind, and create, these really great things going on inside you, they also will keep you from obsessing on yourself for just a moment and helps you break some of the cycles that you've already gotten yourself into and how you think. And as Bryan, as you were talking about a couple weeks ago, in the cognitive dissonance and stuff, and it helps to break those patterns and those things.
Yeah.
So definitely, focus on that, people, and focus on the positive stuff.
Right. And, it also, can be said, too, that you don't have to wait till someone's house catches on fire to do these things. You can.
Absolutely.
There's always places, women's shelters constantly are in need of, blankets, soaps, those kind of things. Food banks are constantly in need.
Mm-hmm.
Blood banks are in need. Like that kind of thing. There's a lot of things you can go do if you want to just. If you want to give, but you don't have a lot of money, you still can, you can
mm-hmm.
volunteer, you can,
And you can give positivity. One thing that I do consistently now that I started quite a few years ago, I often admire people. I'm very aware of people around me and, their shoes or their hair or whatever. I like to admire people and things that strike me. And I always would keep it to myself because you never know, like Heno mentioned early on, it's like, when you give a compliment, you're kind of putting yourself out there or whatever. Mm-hmm. But I make a point of always complimenting. If I think it, I'm saying it.
Yeah.
It's like, you got great shoes, I'm letting you know you got great shoes. I love your haircut, I'll tell you I love your haircut.
Yeah.
And, someone else asked me why, they're like, really, you need to say, I'm like, you know what? That woman loves those shoes. They're really unique. They're very cool. Intrinsically know that she loves those shoes.
Right.
And has somebody that, is me going out of my way just to say, those are really amazing shoes, probably made her day because it validated her feelings and validated her decision.
Right.
It's
funny how... Go ahead.
I said, and she's going to go home and look at her partner and say, how you don't like these shoes? A woman at work just said she loves these shoes. So there.
Which will just probably warrant well, then that's someone else who has bad taste. I don't know. It's just funny when you were saying that about validating their opinion and stuff, because it reminds me of when I worked at the video stores, when people walk up with movies. Mm-hmm. They want so badly for the clerk to be like, this is really good. If like when they walk up mm-hmm. and be like, hey, how is this? And you're like, then they're like, man, because it's, but, like any of it, it's all subjective, I mean,
absolutely,
there's always a fan, no matter how bad the movie is. there's always somebody who saw it and was like, I don't know why people hate it. It was pretty good.
Right.
You know, and
hey, hit the chord with you. Why not?
yeah, it's just no matter what the movie is or the shoes or, you know, whatever, the article of clothing or something, there's always somebody who, you know, just seems to love it. So it's like, yeah, whatever.
Someone's going to love it. Someone's going to hate it.
Mm-hmm.
Everyone's got an opinion.
Yep.
So, in the topic today, kind of I've been dancing around it a bit, is sad. Now, we're not talking the traditional sad, although it does apply. The sad we're talking about is the seasonal. What's the A stand for? Because you sent me the link.
Affective. It can stand for different things. It can stand for anxiety. It can stand for affective. I think there's another A that it can be also, but it's all pretty much the same thing. Like there may be slight differences, but it's, you know, I think it's overall it's about the same thing. Essentially, though, the more important letters are the S and the D because they're it stands for seasonal and depression. You know, and there's a lot of people that not just like around Christmas time, but as the, you know, weather usually tends to kind of gray out and things become just more overcast, like especially in this area, you know, in the, you know, Michigan, Ohio area, usually once it gets middle October to late October, everything is just blah for a couple months, you know, until winter, and then usually we get snow, which, you know, adds at least some difference to it. So, but this affects a lot of people, you know, and like I've got a thing here that was on a Huffington Post that's 10 things everyone should know about seasonal depression that I figure we could kind of go over here because it's, you know, just some good points.
Absolutely.
Obviously, you know, if you want to look more into it, you may, like if you type in sad versus depression or something like that, what comes up generally is the comparison of generally being sad versus depression. So it's not the same thing. So if you want to look it up yourself, you know, look up seasonal depression and, you know, that should get you, you know, a WebMD page or something where it has overviews and whatnot.
Or you could probably do the S period, A period, D period.
Yeah, probably. Because, you know, that's the difference is usually when people refer to it while it's typed, it's capitalized, you know, because it's a condition or, you know, each part of it is part of a name. So, yeah, the first one is the underlying cause of SAD isn't just bad weather. It says in most cases, SAD is just a seasonal component of clinical depression or bipolar disorder, according to Michelle Reba, professor of psychiatry and the associate director of University of Michigan Depression Center. For people who see a regular pattern every year of getting sad, anxious, or a cycling of moods, the first thing they need to do is see someone to get an overall diagnosis, she said. They need to treat the underlying depression. You know, because there are some people, like honestly, like with me, I get more depressed this time of year. But I don't know if it's really a seasonal thing or if it's more based on, you know, life events. You know, I think mine's probably more based on my life than it is, you know.
And I've got my season is it's actually not necessarily a season per se. It's kind of a temperature range. When in the beginning of spring, when spring is starting, and beginning of fall. So like the change in when it starts getting from cooler to warmer and warmer to cooler, those areas right there, I'm really susceptible to depression, to mood swings, to anxiety. It's really, I don't feel like I'm right in my own skin.
Yeah. And I think for most people it's because I would assume that you're getting you know, the lack of sunlight is what generally is the reason for it, you know. And plus you can't go outside anymore, really. You know, like when it starts getting cold, you start seeing outside as, you know, not acceptable or not accessible anymore. You know, you're like You know, because in like June, you're like, hey, let's go whatever, you know, to the park or whatever. In November and December, you're less likely to do that because, you know, and again, in our area. In some areas, sure, you could all year round. But like for, you know.
And it's just, it's so weird because, especially in my case, it's not really tied to anything like that. Because a lot of times the sun is even more prominent, especially in the spring. We're going out of the gray into the sun.
Mm-hmm.
You know, so it's just, it's really odd. Over the years, I've never been able to tie it to anything in particular.
Mm-hmm.
You know, and it's just one of those things that I know I'm going to have, like, I almost feel like my entire skin's crawling.
Mm-hmm.
Because of anxiety, and I just want to hole up. I don't want to do anything. And, I mean, even talking about it gets me all like,
right.
You know. It's just, it's a horrible, horrible feeling. I absolutely hate it. Yep. But the key is being aware.
Right.
And I try to be as aware of the timeline. If I'm starting to feel funky, I'm like, okay, I know what this is about. And I just, you know, I have to write it through.
Right.
Write it out. But, it sucks.
Yeah, the second point here is it's not a punchline, which we've gone over with anything we've talked about. Again, you know, choosing your words. Says it can be easy to blame a bad mood on the earlier dark skies, but people should think twice before saying they must have sad. And again, sad as in this, not that you are sad, because that, you know, we don't want to, you know, you can't tell someone they're not sad kind of a thing, you know.
Right, that's an emotion.
Right. The condition is hardly something to be flippant about. It's not something to laugh about or joke about, Reba said. It's a significant health problem. And then in this list, they also have another, a list of other mental illness terms that should not be used nonchalantly, which I appreciate. The next one is there are multiple ways to treat SAD. For a long time, many considered light therapy one of the gold standards of SAD. And the light therapy is usually you go by a lamp that has like the true light bulbs that give off, I forgot what it is, light that the sun gives off. So
ultraviolet?
I don't remember, but when you're sitting there, it's essentially, it tricks your brain into like that you're sitting in the sun kind of a thing, so that if the lack of sunlight is your issue, that, you know, it can kind of, you know, it literally brightens up, you know, what's going on.
I've heard tanning booths can also be beneficial.
But those are also high risk compared to, like, these lamps you just have in your room. You don't necessarily have to have it, like, right on you or over you. So,
right, exactly.
Let's see. It says, experts theorize this technique helps correct the body's inner circadian rhythm and produces feel-good hormones that people get from the sun during other times of the year. However, light therapy isn't the only route. Since the key is treating the underlying depression, that could include methods like cognitive behavioral therapy, medication, or both. Recently, a study published in the American Journal of Psychiatry found that talk therapy may even be more effective than light therapy when it comes to treating SAD. But keep in mind that the best method varies from person to person, Reba says. Any active treatment is better than nothing, which is true. You know, if you're dealing with this, or you think you're dealing with this, you know, go find, you know, go to your doctor, get a diagnosis, and then, you know, get a course of action so that you're not, you know, trying to just deal with it yourself.
I think what they said right there, incredibly, incredibly important for everyone to hear, is that everybody's remedies are going to be different. You know, it's the exact same thing with mental illness.
Yep. Well, this is mental illness, so yeah.
Oh, yes. Yeah, but, you know, this one, but for like bipolar and depression and anxiety, the medicines that people can prescribe, doctors can prescribe, there's a reason why there's so many different ones. And it's not just because, you know, some people like Pepsi, some people like Coke.
Yeah.
It's because sometimes this works for somebody, sometimes this doesn't work for another person. They have to try different variations. You know, there's so many different types of different therapies, medical therapy, you know, medicinal therapies, as well as cognitive and behavior therapies and stuff.
Yeah. And many times what ends up working the best for most people is a combination.
Yes,
You know,
absolutely.
like, and one way doesn't, usually just going on medicine doesn't do it, or going through talk therapy doesn't do it. You have to, usually you have to combine the two and then, try to get the best results or whatever. But again, there are people who've just gone on medicine and that's made a difference, made enough difference that that's all they did. So, like you said, it's very much person to person.
It's a perfectly crafted cocktail.
Yeah.
Medicinal and therapeutic cocktail.
Let's see.
There we go.
Yep. Point 4 is says that but it may take some time. Reba says that most doctors don't determine if a person has SAD until they've experienced at least two episodes, essentially seasons, of the disorder. In other words, it may take a little while to make sure it's the right diagnosis. Physicians want to make sure that they're treating every aspect of a mental health disorder properly. Yeah, they'll probably, my guess, I don't know, again, not a doctor, but I would guess they probably will determine that you have depression or bipolar, depending on your other symptoms, and then probably treat from there. And then if it keeps coming back and worse, this kind of thing, then, elevate it to SAD also,
Yep.
The next one is, it's debilitating. Symptoms of SAD include sadness, fatigue, and loss of motivation. Any depressive disorder can also be physically exhausting. People with depression often experience headaches and changes in appetite in addition to their emotional symptoms. Boy, howdy. The headaches are probably different for me, but, a lot of this stuff, is, I read a great thing, was it yesterday or the day before? This isn't about SAD, but it was, a woman wrote an article about how she's is on disability because basically fighting her depression has been a full-time job. Like, she spent all her time and energy trying to do that. And I was like, yes, I totally get it. Like, it just feels like that's all you have energy for, is to try, to just not give in, basically. Again,
Right.
it's picture somebody who can't swim out in the ocean. You know what I mean? It's like, it's all you can do to not drown, basically. That's how it feels a lot of the time.
Right.
So, yeah, it is, like with this, it's debilitating, or, it's exhausting. Exhausting is such a great word, because it, even saying it, sounds like it's exhausting,
Yeah, absolutely. I mean, I can't even fathom. I mean, some days I'm so tired, but I know that I am 1/10 of what some other people can feel.
Yeah.
It's not a competition. I'm not trying to make it a competition, but I'm just saying that I'm very well aware, I guess, of how tiring it can be.
Yeah.
But on the flip side, also, what others may experience as well.
Yeah.
Well,
you've also had a first-hand account of seeing it,
Oh yeah.
You saw how many days and what it did to me, so it's that a lot of people don't get that insight, which is good and bad. It's bad because they don't understand as easily or as well, but it's good because that means no one around them hopefully is suffering like that. But
right. And it's one of those things that it's so hard to wrap your brain around, the lazy versus fighting depression.
Yeah.
Because it's so simple and so easy to say, oh, you're just being lazy. Just get off your butt,
right. Yep.
And same thing with SAD. I'm sure that people who are diagnosed and have SAD, I'm sure go through this all the time.
Well,
it's
it also doesn't help that the name of the condition is something that people are going to make light of.
Exactly.
Oh, what's going on? Oh, I suffer from SAD. And, oh, you're sad, boo-hoo. It's ridiculous. But that's why when I first heard of the condition, and I was like, wow, that's maybe not the best term they could have come up with for that.
Right.
Because it's going to lend itself to people making fun of it,
Mm-hmm.
So.
Absolutely.
Yeah.
So, next on the list?
SAD doesn't always occur in the winter. It's rare, but sometimes people do experience the condition in the spring or summertime. These symptoms usually include increased feelings of agitation or anxiety, according to the Mayo Clinic.
So I guess maybe I do have SAD.
Maybe. I don't know. Yeah, it's it's the same thing. It's like it makes sense because I could see there's some people that, it could have something to do with too, and just in your head that there's certain things that tie to seasons that are depressing for you,
Yeah.
Like me, even if it wasn't for the change in the weather and stuff, my the anniversary, my dad's death was in October. And because of not having my dad, Christmas doesn't feel the same to me anymore. It's just that kind of stuff. It just kind of leads into a kind of feeling for a few months there. And I think that, if Christmas and all that fell in July, I don't think I'd have this issue. Like, independent from that. So that's why I said I don't think I have SAD. I just think that,
it's situational.
Yeah. I think mine's more of my life than it is anything.
Yeah, I don't really think I have anything that stands out anyways as a reason in life.
All I notice is, like, on overcast days, I'm just sluggish, more sluggish,
Yeah.
That's all there is, but it's not something that really ties. I mean, it could be the middle of May and whatever, and I'm just like, but I'm that way on a lot of days anyway, so it doesn't take a whole lot to push me a little further,
Yeah.
But
exactly.
Let's see, what's the next one? The condition is complex. According to Reba, SAD can not only be a component of major depression, but also bipolar disorder and other mental health issues. A rare case of SAD may also have contributed to one woman's obsessive-compulsive disorder flare-ups during the winter months. Experts agree that there may be a tie between seasonal changes and exacerbation of illness. Like all mental health conditions, the disorder is complicated and as such deserves thoughtful and effective treatments from a physician. Which, it's what we're always saying, like it, don't self-diagnose.
Yeah.
It's one thing to look up and research so that you can maybe have an understanding. I did that with depression because I had self-diagnosed, but when I went into the doctor and talked to her about it and stuff, it just, it made tons of sense. Like, she just basically justified the stuff I had read. And, being knowledgeable is one thing, but, let your doctor make the diagnosis.
Absolutely.
Yeah.
There's a reason they went to school and stuff, and they have more knowledge of the variations than you do by looking things up online.
Right.
They just do.
Well, yeah.
Plus, that does not make you any stupid or not as intelligent.
No. But reading online generally gives you the blanket. It gives you the generalities of a condition. They're going to be more familiar, like you said, with the specifics of it. Like, I can go in and rattle off 4 or 5 things and say, well, I think I'm depressed. And they can go, in their head, they can go, you didn't name the 1 or 2 things that are the difference between being just sad. I don't mean sad as in this condition, but just you're down versus depressed, so there, it could just be that kind of thing. So just be careful with that. But if you think you do, as we always say, if you think you need some help, especially if anything like this is altering your life, like when things change your life for the worse, go talk to a doctor and make sure that it isn't something that's treatable. I read something the other day that said the average person that deals with depression waits 10 years before they go get help.
Really?
That's the average. And I was like, wow, that's
horrible.
Horrible. Yeah. And mine was longer than that, but it was, that's a lot of people, if you think about it at this point, go back 10 years and how much was depression talked about?
Right.
Whenever you talked about depression, it usually had to do with someone who had committed suicide, and that was probably about it. Now we see that people everywhere are living with depression, So, the next one, I'm sure won't surprise either of us. It's more prevalent in northern states.
Yep.
People who live in colder, cloudier climates may be more susceptible to the disorder. Northern states have higher rates of SAD than southern states, according to the University of California, Irvine. You know, that does not shock me at all, because if it is in any way tied to the sunshine or warmth or whatever, we lose both of those things for months, you know? So I'm not surprised.
Exactly.
Days blend together here. Plus, with the time change, you know, a lot of people go to work when it's dark and get out of work when it's dark. It's, you know, there's a lot of things that kind of all filter into it. So, let's see, what's the next one? SAD is more common in women. Studies show women have higher rates of depression than men, including SAD, the New York Times reported. However, that doesn't mean men are immune. Depression doesn't discriminate and can affect anyone, regardless of gender, ethnicity, or biological factor. Which, yeah, I knew women are more likely to have depression than men, but
I did not know that.
Yeah, well, there is. I mean, there are some factors in there that men can't get really.
Like postpartum.
Yeah, so there's elements of that I'm sure skew the numbers a hair, but you know. And for years, those numbers probably came from housewives versus men who went to work. So I'm curious if those numbers will change as we go on, where more women are working and less guys are working. I'm wondering how. I'm curious just if those numbers will stay like that or if they'll skew the other way.
I honestly think the rise of the more enlightened man. And I had to say it that way because I don't know quite the right way of saying it.
Yeah, I know what you're saying, though, yeah.
But men are becoming a lot more, I shouldn't say becoming because they've always been this way, but I think society is more receptive to men being more sensitive and more in tune with their own psyche, their own being.
Yeah.
So, which makes it easier for men to be able to come forward with mental illness.
Yeah, well, that was something else I was going to mention is that I wondered if the numbers were skewed because women are more likely to go to a doctor than men are.
Right. Men
in the past typically would deal with depression via, you know, putting one in their head or hanging themselves or something, you know, that kind of a thing. Like they would just bottle it up until they couldn't handle it anymore and then end their lives or something. So I kind of wonder, you know, those things all factor in. And those are numbers I'm always curious of, like the little particulars that can kind of change the numbers just a hair this way or that way, you know. So
the creative art of numbers.
Yeah. I mean, don't get me wrong. I'm sure this is accurate probably no matter how what you put in there. It's just, it's interesting to me, though, because there's probably no room in a study or whatever for an estimated amount of guys have depression, you know, that kind of a thing. So I don't know, but you know, hopefully if you're a guy and you're listening to this, if you feel you have these issues, you know, go get the help you need because, you know, you're better to and for everyone, you know, if you can get help. You know, trying to fight it yourself doesn't make you stronger. It doesn't.
Nope.
It only makes you weaker because you have less hands, you know, filling sandbags trying to keep the levee from breaking, you know?
Exactly. I mean, you wouldn't walk into a hurricane and say, no, guys, I got this.
Exactly. Yeah. It's,
you know?
No, a team works much better.
Yeah, exactly. It's like, come on, let's be smart and logical about something.
But that's that's the way.
Completely against the disease.
Yep.
Smart, logical does not equate.
Well, plus
disorder.
That's how guys were taught. You know, you don't admit weakness. You know, you don't show weakness. You don't admit weakness because it makes you less of a man, and that's all garbage and not true, and all this kind of stuff. You know,
fallacies that we teach our children.
Yeah,
it's awful.
Yeah, and hopefully, like you said, as across the board we've changed thinking, hopefully that'll go away over time too, because that's maybe one of the most dangerous types of things ever taught to people. is that men don't show any weakness. Like, even if you have, like, chest pains, you're not supposed to admit weakness. If you're depressed, you're not supposed to admit your weakness. You can't, and it's like, so you're supposed to just ignore what could be potentially major, health issues just because, that's not what men do. It's like men keel over at 40 from a massive coronary rather than get on a medicine or something, So
Bill Burr does a
hopefully that
really
goes
great
away.
sketch on that.
Yeah, he does.
He does a very, very good stand-up bit on it about how guys can't do anything, even slightly girly, without their buddies in their heads.
Yep.
Calling them names and stuff and teasing them and making fun of them.
Well, yeah, it's either your buddy's voices in your head or it's like your dad's voice. Like, my dad wasn't that kind of guy. He didn't admit weakness, but he also was never, like, to me, the type that was like, no, men don't do that. He wasn't one of those guys, He focused his energy more on what men should do.
Yeah.
What you should be as a man, not what I shouldn't be or whatever, so...
Right.
Let's see. Number 10 here is it should be taken seriously. Above all, mental health conditions like SAD are manageable, but only if people seek the help they need. It's important for people to recognize these signs within themselves and get evaluated, Reba said. This isn't a trivial problem. It's part of a major mood disorder that really needs to be addressed, but it is treatable.
Nice.
Yep. And
I like it.
Yep. Me too. It was something I, kind of was brought to my attention in the last couple of days, and I was like, we should talk about this because, first of all, it's timely with, type of year it is.
The season change,
right.
Time of year, all that good stuff.
But it's also, and like I said, I'm reading about it essentially for the first time, even though it can be a form of depression. It shows, person to person. Like I said, I've never really noticed, aside from my, from stuff in my life that's made me more depressed this time of year, I'm pretty much year-round, I think I'm pretty much the same as far as my depression goes. It might, obviously there's fluctuations, but I don't think that it, I don't think any one season or anything, or any certain time of year really puts me in a worse position than the rest. So.
Gotcha.
Yeah. And, I do know people with this, and it stinks because, most of the year they're pretty happy, members of society and stuff, and then it starts as it gets closer to winter, you notice that, like, you'll see them posting on Twitter or something, and you can tell. You can just see the difference, that it seriously is like, like, wow, there's no sunshiny tweets from them. They're all gray and overcast, and it's, like I said, it's a almost exact translation of the weather to the person kind of a thing, But again, as it said in there, it may not be a weather. I've also heard of some people having, like, just having a vitamin D deficiency that treats itself to where they get super down.
Really?
Yeah, and they thought that they had SAD. They went in and found out it was a vitamin deficiency. It wasn't a mental health issue at all. Once they got on vitamin D, they were fine. Whereas vitamin D doesn't cure depression. Like, if you're depressed, vitamin D might help, but it's not going to be a cure for it or, take it all away.
Mm-hmm.
So.
But hey, at least it, for that person, it helped.
Yeah. But again, you don't see, if you look it up online, you're probably going to diagnose yourself as a person with SAD. And as a result, they went to a doctor, and the doctor said, no, actually, here, take a vitamin supplement. And that was it. Boom, they're back to being who they were, which is awesome. That's fantastic if that's all it takes,
Heck yeah.
That'd be great. But, but again, you don't get there if you don't go talk to your doctor.
Exactly.
Like, again, if you self-diagnose, you're just going to assume you have SAD. You probably go buy a light, and those lights are not cheap. Those therapy lights are expensive.
Yep.
You buy one of those, and it's like, wow, this really isn't doing a whole lot for me, and, Plus, that still isn't treating, if you have depression or a bipolar issue, that's not treating those things and leaving, those might be, the worst part of the whole situation. So,
exactly.
Don't trust yourself. As I said earlier, don't trust yourself to make a diagnosis, go.
Trust the professionals.
Yep.
That's what you pay them for.
Yeah.
Mm-hmm. So with that, I think we've done a pretty good discussion, at least the first round of discussions on SAD.
Mm-hmm.
I can definitely see us returning and doing a little bit more in depth.
Yeah.
But, yeah, I mean, that's very interesting. It's definitely given me a few different things that I want to think on, and comparisons and stuff.
Yeah.
But if you want to continue the conversation with me, you can always contact me through Twitter at Jen's Crazy Life. You can also contact the show at thecrazylifepodcast.weebly.com. You can also contact the show by writing us an email at thecrazylifepodcast@outlook.com. And you, Bryan?
You can also find the show, like I post when new episodes go up, on Twitter at The Crazy Life Pod. You can find me on Twitter at Stunami. If you want to find my other podcast, which is Salty Language, you can find them on Twitter at salty_language or over at saltylanguage.com. Our pal Heno did our intro song. You can find him on Twitter at Ida Heno. You can also find us we're part of the Tangent Bound Network and the Wicked Radio Networks. So go give them a look. You can see a bunch of other cool shows on those networks. Let's see, am I forgetting? No, I think that's all the contact stuff. You can, and again, as we say every time here, we're not doctors, therapists, trained professionals, certified anything. We're just two people with mental illnesses, just generally talking about our experiences, or like this, just trying to, this episode, bringing something that neither of us, well, Jen may, but, something that we hadn't talked about before, and to give us a better understanding of, that condition. But if you are a person who feels you need help, or you do need help, you need help, please go seek it out. Go to a doctor or a therapist, or find a group, a support group of some sort. Whatever it is. If you think money is what's holding you back, check with your Department of Human Services or the Board of Mental Health. There may be things in your area to help you out, or there may be free groups or whatever that you can be part of. And of course, lastly, if you're in a dire situation and you feel you're thinking about harming yourself or others, honestly, please don't. Please call either 911 and tell them you're having a mental health emergency, or call the suicide hotline number, something of that effect. Or, if you can get someone to drive you to the emergency room, just, do that. But again, please don't take your own life, and please don't harm anyone else either.
Exactly. Always remember, as long as you are thinking, you have choices. So use your choices. Make them wisely. So, I guess with that, I'm going to steal Bryan's line and say, keep breathing, everybody. And my line is, happy holidays. Enjoy.